Good morning, everyone. Today we are going to learn about how to prepare, evaluate, and submit aspirin tablets IP. Okay, so I have prepared one presentation. Okay, so you'll get a clear idea about how to prepare aspirin tablets. So this is the marketed formulation of aspirin tablets by Aspirin 75. Aspirin 75 indicates the drug or active pharmaceutical ingredient, which is aspirin. It is 75 mg in a quantity. Okay, it is manufactured by US Private Limited. So, while going to formulate aspirin tablets, you require three particular major ingredients or chemicals, that is aspirin, talc, and starch. Okay, you can use on okay, the formulation showing like maize starch or corn starch. So it is totally depend on that. So this is the theory. Aspirin tablets are used for generally analgesic and antipyretic, anti-rheumatic, and anti-thrombotic actions. So acetyl salicylic acid is highly unstable that uh, the drug that readily undergoes hydrolysis, hence wet granulation method. So see what is the major difference between wet granulation and dry granulation is that wet granulation having a required water for doing the granulation technique or method in our entire process. And while dry granulation does not require any kind of water or water moiety. Okay, so wet granulation cannot be used for majorly for that particular purpose. So when aspirin is available as granular material, direct compression method is normally used. If powdered aspirin is available, dry granulation method, that is also known as slugging, is preferred. Direct compression method is economical and quick method of production because the number of steps involved are few compared to wet or dry granulation methods. Since the dose of aspirin is high, that is 300 mg, only small amount of additives are required. For direct compression of these tablets, normally directly compressible excipients such as microcrystalline cellulose, MCC is the abbreviated form of it. MCC, spray dried lactose, then dicalcium phosphate, dehydrate. Okay, so these are the agents or chemicals that are used. Starch is used for better disintegration process, whereas talc is used as a lubricant. So requirement for this to perform this experiment is apparatus containing weighing balance, mortar and pestle, measuring cylinder, sieves number 22, 44, and 60, beaker, watch glass, dryer, that is hot air one, then compression machine. In the chemicals, we will require aspirin, starch powder, and talc that we have already seen. So aspirin has analgesic and antipyretic properties, but it has no useful antipyretic properties. Aspirin is readily absorbed from the gastrointestinal tract, that is from GIT, and aspirin is characterized under BCS classification 2. So what is BCS? BCS is biopharmaceutical classification system was discovered by scientist Gordon Amador. Okay, that scientists have classified four major important classes, and one of the highly used classes that are highly soluble, highly permeable. Okay, then second class is highly soluble. Okay, and lowly permeable. So tablets are solid dosage forms containing one or more drugs with or without excipients. Prepared by compression, it provides excellent dose precision and least content variability. Inert materials employed in addition to active ingredients are collectively called tablet additives. They include diluents, binding agents, disintegrating agents, adsorbents, anti-frictional agents, compression, granulation method. Okay, so see what diluents, what is binding agent, disintegrating agents, adsorbents, anti-frictional agents. So the definition, including with their examples, we have already mentioned here. Okay, so we are first of all going to the granulation method. The active ingredient, dilute, and disintegrants are very mixed or blended well. So solutions of the binding agent are added to the mixed powder with the stirring, or you can use continuous stirring. The powder Mass is weighted with a binding solution until the mass has then consistency of damp snow. If the granulation is overweighted, the granules will be hard, and if not weighted sufficiently, so the resulting granules will be too soft and breaking down during lubrication. So the weight mass is forced through a 6 or 8 mesh, and mesh number is the number of wires passing through an inch. So screen or several mills can be used moist materials from wet milling steps. It's placed on a large trays and placed in the drying chambers with a circulating air current and thermostability controller. So commonly used dryers are tray dryer, fluidized bed dryer. After drying, the granulation is reduced in the particle size by passing smaller mesh screen. And after drying granulation, the lubricant or glidants is added as a fine powder to promote flow of granules. So these granules then compress to get the tablet. So this is the formulation table for aspirin tablet IP containing ingredients aspirin IP starch powder that is 5% and talc IP that is 2%. The standard quantity that is quantity given for one tablet that is 0.300 gram and 0.015 gram, 0.06 gram for talc IP. Okay, so we have to calculate the quantity for 10 tablets or whatever we have required. Okay, something like 52. So just we have to multiply it with the one standard quantity given for one tablet. So I have to prepare 10 tablets of aspirin IP. So I have multiplied it with the standard quantity for one tablet given that is 0.300. So 0.300 gram into 10 is it gives to 3.0 gram. So similar to that way, we have calculated or multiplied by for 10 tablets with the quantity of standard given for one tablet. And so role of aspirin IP is analgesic, antipyretic, antirheumatic, and antithrombolytic. Antithrombolytic. So as we have already seen, then starch powder is disintegrating agent, and talc is used as a lubricating purpose. So these are the some kind of records that is BMR report or BPR report. Okay. So if it is containing in your manual or in your practical book, so then only you record it. Similar like aspirin tablets, so them is already given strength is 300 mg, batch size is 50 tablets. So if you are preparing 10 tablets or 20 tablets or whatever it may be, so you have to mention here batch for batch size 20 or 30 tablets. Then manufacturing date, whatever you have prepared. If you are preparing July, then you must have to give expiry date after 50 months from the date of the manufacture. So just calculate and whatever it may be, you can just write it right here. And batch number is like your whatever you are in which batch, A batch, B batch, C batch, or types of multiple batches. So just give it the number of batch and so give your roll number. Okay. Then manufacturing license number that is same. Just give your initials. Suppose my name is GGS, so I'll give GGS and dash. My PRN numbers last two numbers or something. Okay. Manufacturing preparation area pharmaceutics lab. Okay. So generally industrial pharmacy it comes under the department of pharmaceutics. So whatever the practicals are performing that obviously perform in the pharmaceutics laboratory. So just right here. Then cleanliness of area done by. Okay. So uh, those who are making a hygiene or whatever, they just write the lab name of your lab attendant and sign it, get the sign. Okay, so they are very casual details. Just fill it and then we must have to see the procedure. So first of all, calculate the weights of ingredients based upon number of tablets to be required for evaluation and submission. Then weighing, so weigh proper acetyl salicylic acid slightly more than the required quantity. Screening pass weighed aspirin through. Okay, so many of the people's confused with the acetyl salicylic acid. So aspirin that is aspirin salicylic acid and slightly more than the required quantity. So screening pass weight aspirin through 22 to 44 mesh sieves, collect the drug written on the 44 mesh sieve. Okay, so make it a number AG as a coarse powder, collect the powder, pass through 44 mesh sieve. Also give it number the BG, okay, as fines. Then we have a major important part, that is mixing tech required quantity of this aspirin and its 50% fines, whey, 50% starch and powder, and 2% of talc powder, and transfer to the mortar. Then blend whole of the wheat coarse powder with the fine starch powder and talc powder slowly in the mortar, and mix them in order to get a uniform distribution of the ingredients. So now the blend is ready for compression. So another major step is the compression. So adjust the dye and cavity and pressure of the punches in order to get tablets of desired weight and all the parameters of tablets such as thickness and hardness. Okay, so usually 8 mm dye cavity is used. Then calculate the production yield. Okay, using the formula production yield, that is percent yield is equal to weight of tablets divided by weight of granules. And what was the answer? Just multiply it with 100. Then packing. So transfer compressed tablets in a wide mouth, tightly closed container, and store them in a cool and dry place. Then container needs to be properly capped and cleaned, and labeling, prepare appropriate label and fix to the container. Now, which type of labeling you have to level? So just we like whatever we are doing for or same for the syrups. So evaluate tablets for test mentioned in evaluation table and submit reference experiment number 6 for test procedures. That is we have already taken. Then composition. So each tablet contains 300 mg aspirin. Okay, so that is the major basically, and this is the type of the majorly you can doing for just going for the procedure, and we'll get that kind of the photos, and so this is the aspirin granules, and this is the proper link if you are you require a recitation of the entire equipment. So again the entire okay. So these are the samples of aspirin if you are doing for a batches or previously. We have also mentioned in the procedure that we have required that a particular kind of the 300 mg per drug, so per tablet. So for that proper dividation, we require drugs like that. This is the mechanism involved in a wet granulation. So this is the entire process of wet granulation. Okay. This is the failures of aggregation phenomena or the best performance in terms of granulation, lab fluidity, and overwriting the phenomena. So these are the A, B, and C types of granules, I guess. Then this is the simple process that where we have to first of all save the all ingredients. Okay. Then okay. So then after that make a PVP paste. Okay. Added into the whatever the course or fines of the both chemical ingredients. Then prepared a paste. Okay. Or make a roll on, make a mask or roll off, make a roll on your hand, and uh, just try to prepare it. Okay. After wet roll mask. Uh, Hello, am I audible? Okay. So after wet roll mask, just save it and go to the hot one for 30 minutes at 60 degrees Celsius. You'll get the fines of granules, and after that, the one of the most and major important thing is that like the evaluation of granules. So you have to evaluate our granules for bulk density, tap density, Boston ratio, the angle of repose, that is theta. Okay, so these are the compression cycle, and this is the major important part of compression roll, tablet punch. So this is the way how tablet get discarded from the tablet punch machine. These are the another videos for your reference, for your information. These are the aspirin tablets, whatever we have prepared. And later we will have the details like that. We will completely to the next part. Thank you.